Neighborhood Health Watch is sponsored by the doctors of HCA Virginia Health System.
The topic today in Neighborhood Health Watch is expanding birth options. The moment a woman finds out she's going to have a baby, she starts asking questions and considering all the options. Among the first questions, will the baby be born at home or in the hospital? Natural birth or epidural? What kind of practitioner will deliver the baby? Meghann Batten is director of the Nurse Midwife Hospitalist at Henrico Doctors Hospital. She's here to help us explore some of those options. Thank you so much for joining us.
Thanks for having me.
Yes, first, what is a nurse midwife hospitalist?
So certified nurse midwives take care of women throughout the lifespan. They do well woman care, prenatal, labor, delivery, and postpartum services. The nurse midwife hospitalist is someone who is focusing on that inpatient care, so taking care of women during their labor, birth, and immediate postpartum period.
Why are midwives becoming more popular? Still the OBGYN, that's still the most common caregiver for pregnant women.
Yes, nurse midwives offer very personalized attention to patients, and I think people are sort of getting back to the idea of natural or low intervention birth, and so they're starting to consider nurse midwives as an option both in and out of the hospital.
And what factors specifically should a woman consider when making a decision like that?
Well, nurse midwives tend to focus, we are specialists in normal birth, and so one of the things that...
And that's the key, normal birth.
Correct, and so when we look at it, patients who are going to elect a nurse midwife tend to be experiencing a low-risk pregnancy and have interest in a normal birth and expecting a normal birth. And so we take care of those women who are seeking that kind of care in the hospital or planning that care.
And how do they expand the options at Henrico Doctors?
So nurse midwives, as normal birth specialists, are looking to meet with women during their pregnancy and kind of discuss the kind of birth care that they desire. Some of the options that we will include are different labor and birthing positions, alternatives to traditional pain medication, so things like massage, continuous labor support, hydrotherapy, aromatherapy, things like that.
Just curious, is there a difference in how insurance companies view the two?
There isn't a difference. So whether your doctor or a nurse midwife takes care of you in the hospital, there's no difference.
All right, awesome. Thanks a lot for joining us. We
Thank you.
appreciate it.